Hello everyone, I am Dr. Danish Salim. Today I shall discuss with you about a commonly asked question. What are the precautions to be followed by a person who comes in contact with someone who is COVID positive? So we should know that we should not fear the coronavirus. All we have to do is be a little cautious. It is necessary for you to know the actual facts about coronavirus. So I shall explain them briefly. There are two types of contact: primary contact and secondary contact. Primary contact means the person who comes directly in contact with someone who is laboratory positive, that is RT-PCR or antigen positive. Secondary contact is the person who comes in contact with the primary contact. For example, if I am COVID positive and I speak with someone in close contact for around 10 to 15 minutes or more, there are chances of them contracting the COVID through my speech or when I cough or sneeze, even with my mask is on. Hence, to reduce the contact time with a COVID patient, maintain a distance of 2 meters at least while you speak with a COVID positive person. If you stay in an unventilated closed room or a hall with a COVID patient, immediately open up the room, open the windows so that you can be prevented. So what are the precautions to be taken if such a situation arises? Is there a need to get tested? No. People who are asymptomatic need not get themselves tested. But if you have come in contact with a COVID positive patient and have any of the symptoms like fever, cough, diarrhea, loss of smell, test is mandatory. Screening is done in some places, especially if a family member is tested positive, the rest of the family is screened to detect any form of infection. But we must understand that the tests are required when there is symptoms. The person who has come in contact with a COVID positive person can develop symptoms within a span of 14 days. If there are no symptoms in the 14 days, the person is safe. But if he develops any of the symptoms in the 14 days, there is possibility of a COVID infection. So you have to know this much. So even if you are positive, follow 353, 365, 386, many videos we have done. A COVID positive person can infect another person 3 days before he shows symptoms and 10 days after he develops the symptoms. So on the whole, the infection transmission takes place in a span of 15 days. That is the maximum period. The primary contact should follow certain steps for 14 days so that even if he or she is negligible, even if he is COVID positive, by initiating their own immunity through 8 hours sleep, drinking 3 liters of water, consuming fresh fruits and vegetables, avoiding stress, eating a balanced diet, that means the food containing 65% of carbohydrates, 15% of protein and 15% of fat, exercising for about 150 minutes every week, refraining from smoking, alcohol, sugary drinks, and avoiding processed food. So these are the things which you have to look for. Many women have asked about the precautions to be taken about their spouse who visit home and under home quarantine. So symptoms, if any, arise in a span of 14 days, you have to test COVID. So otherwise, no need to worry much. So this you have to know. I took up this topic because many people have repeatedly asked me about the same question. So kindly share the video with everyone and help others stay healthy. So we will come with a good topic soon. Take care everyone.